As Americans stage home offices, cancel social events, avoid public transportation, and otherwise practice social distancing in an effort to reduce the chances of contracting and spreading the novel coronavirus, many are wondering, can we at least go out to eat? The answer, experts say, depends. Your own vulnerabilities to the disease, where you live, and the restaurant you're considering going to itself all matter. Plus, your responsibilities to your community play a role in the answer, too. So much of this is situation-specific. Lauren Dunning, a director for the Milken Institute Center for the Future of Aging, who was most recently at the Los Angeles County Department of Public Health focusing on chronic and infectious diseases. Here, experts break down exactly what you should consider before going out to eat. Older adults and those with underlying health conditions like heart disease, diabetes, and lung diseases, are especially vulnerable to contracting COVID-19 and getting seriously ill from it. I would advise those that are above 50 and/or have pre-existing health conditions to avoid going out to eat altogether. Amit Malik, former clinical director of operations for various hospitals and health systems including New York Presbyterian Hospital, told Insider. That doesn't mean healthy. Young people should rush out for every meal, though. If you're going out to eat, you are putting yourself at risk, period, Malik said, because the virus spreads when people are in close quarters, which outside of a pandemic, are the appeal of restaurants and bars. It's recommended for everyone, regardless of age and health status, to avoid being in large crowded places for the foreseeable future, Malik said, and to, of course, wash and dry your hands frequently and thoroughly. A crowded food hall is not the safest place to dine during the coronavirus pandemic. Oli Scarff, Getty ImagesIf. You do choose to go out to eat, where you go matters. Dr. Darria Long Gillespie, clinical assistant professor at University of Tennessee Erlanger and national spokesperson for the American College of Emergency Physicians, suggested people ask, how many people will be there? How close will you be to all of those people? How well ventilated is the space or how much people can move around? The more people, the more closely packed, and the more poorly ventilated the space, you can imagine that's a bad situation, she said. On the other hand, she said, going to an uncrowded, open-air restaurant with a friend or two is a lower risk. Many states and cities have implemented capacity limits to eliminate the possibility of walking into a crowded restaurant altogether. New York City, for one, has limited indoor capacity to 50% or less at venues including bars and restaurants that seat under 500 people. Venues higher than that capacity have been ordered to close. But the rules vary by jurisdiction and much is left up to restaurants and individual patrons.